This is Daniel Wolfson from the ABIM Foundation and the Choosing Wisely campaign, and I'm joined by Teresa Litton from the Washington State Health Alliance, and we are going to discuss what they are doing with many partners in the state of Washington to advance Choosing Wisely. Teresa, welcome.
Thank you.
And tell us, how did you, and I can remember, but tell the audience about how you originally got involved in Choosing Wisely. I consider you, your organization, one of the early adopters of Choosing Wisely, even before we started the grant program. Could you kind of describe that genesis?
Yeah, so back in the summer of 2012, the Alliance and the Washington State Medical Association joined forces back in the early days of Choosing Wisely, and both of the organizations both kind of recognized the value and importance of the initiative early on and just kind of started from there. And then both were fortunate to be part of both grant cycles. And we're actually excited to see how the grants expanded the work that we'd ever envisioned in the state. So it was exciting to see it kind of grow beyond what we'd even anticipated.
So I happened to be a speaker at the Choosing Wisely Summit, supported by the Washington Health Alliance, the Washington State Medical Association, the Washington Hospital Association, and it was really impressive. Could you talk about the Choosing Wisely Task Force and what they're charged to do and what they've accomplished so far? I think it's so impressive.
Sure. So during the first grant cycle, we were fortunate to be able to convene this group of 20 medical leaders from across the state, really representing 20 of the largest health systems in our state. And they're really charged with implementing Choosing Wisely in their practices. And it's really been fortunate to be a powerful tool for change. And they've kind of been a catalyst in encouraging each other to do more. And so they've kind of fueled the fire for each other. And it's kind of caught on since then.
What was remarkable to me is that you would consider these competitors in the marketplace, but when they've gone around with Choosing Wisely, that has not been the case. They've been about collaboration and advancing all boats.
Yeah.
What's that about?
Well, I think it's the unique thing about Choosing Wisely is kind of this new space. It's kind of allowing for collaboration and innovation that it kind of sparks juices in people to collaborate and innovate in a new way that I think inspires people to at a deeper level. So it inspires their professionalism, but also everyone is aware that there's a problem. This is a big issue, and everyone knows we have to reach across the aisle, so to speak, and really address this problem together. So it's going to take innovative approaches, and so that kind of has created some excitement because there's room for innovation. And I think that is what I'm certainly seeing in Washington State, is that excitement to innovate.
It's like Volvo, telling their secrets about safety in cars. Everybody really wants to share and share their innovation and learn from each other. It was really inspiring for me to see this. What are the interventions that you're using to focus on the three things that you're chosen to work on? I know antibiotics. Could you identify the other two and talk about your intervention? It must be a range of interventions, I'm sure.
Yeah, so we are fortunate to have, the Alliance has a claims database with about 4 million covered lives in Washington State with commercial and Medicaid. So we were able to run the Choosing Wisely measures on Washington State to see where we had areas for improvement. And that really led us to which ones we should really focus on. So we had antibiotics for upper respiratory infections is one of them. And imaging for uncomplicated headache was another area for improvement. And 2 frequent cervical screenings was our third one. So those 3 have what we call change 3 things. So rather than trying to kind of boil the ocean, we're trying to really do 3 things. Let's try to go deep with those 3 things and do those well. And then from that, we can learn a lot through that so that we can apply to other Choosing Wisely recommendations. And so the project has kind of 2 buckets. We have an internal environment and an external environment, really meant to kind of support and collaborate and align everything to support each other. So the internal environment is our 2 partners, Group Health and Swedish Health Services, who are working on clinician engagement, working on audit and feedback, transparent audit and feedback with them to be able to really get that engagement with them, and as well as providing patient resources to patients throughout the visit, so from scheduling to follow-up materials. And then in the external environment, the Washington State Medical Association and the Alliance, we're really working closely together on providing resources and recommendations around provider education, consumer education, consumer purchaser and payer strategies, and measurement and reporting as well. So really kind of trying to kind of hit it at different levels and doing everything in a supportive and aligning way.
So the Choosing Wisely Task Force involved everybody in the state. So your grant is only with 2, but your efforts are really statewide, involving all medical groups, and that's what I think is so impressive. And if we were to have a little part in that, I think that's great. But I think the Washington Health Alliance has really corralled everybody in the state to think about this issue, and it really is impressive. What do you think are going to be the barriers for your implementation of those 3 within Swedish and Group Health?
Well, some of the barriers will definitely be, kind of getting out of the bubble. We have the people that really know about Choosing Wisely. They're really passionate, and they know a lot about it, and they're fantastic to be around. But then once you kind of go outside of that bubble, it's just there's a lot of room, a lot of folks to reach, and a lot to work on. Another one is there's a lot of initiatives, a lot of especially everywhere in the United States there's a lot of initiatives, but in Washington State we have a lot of different grants and initiatives going on across the state and in different organizations. So how do we make sure we are weaving those together so that we're kind of tilling in the same ground and in the same direction? And then how do we kind of take it to the next level? So we've definitely seen an increased awareness of Choosing Wisely in our state, and also have seen increased appetite for more. So how do we provide resources for to really take it to that next level? Those are definitely kind of the challenges that are facing us right now.
And in that, let's continue on the resources, because you've developed 3 resources for the community. Do you want to describe those resources that you've developed already?
Yeah, so we have the technical specifications that we did about a year and a half ago, and we'll be soon refreshing those with some new kind of improvements on the measure specifications. And then we ran those measure specifications on the Alliance's claims database to see where, out of all of these Choosing Wisely recommendations, kind of which ones are kind of big areas of concern and which ones are kind of already are good kind of common practice already. And then there's also the Choosing Wisely action manual. which really kind of follows the Cotter's action change model, where you can really kind of, if your practice is wanting to implement choosing wisely, what are the steps that you need to go through to really, you know, implement choosing wisely into your practice? What are those steps that you need to go through?
So it's really impressive that you've worked with the biggest insurer in the state, Primera, and they've been your kind of your intel, and I see them as a model for other areas, that they can be the intel and let the other organizations, you know, really be the one in contact with the physicians and the consumers. So it's really been a great partnership with lots of different kind of stakeholders. Mm-hmm. So what will success look like in the end of 3 years of the contract with the ABIM Foundation, Robert Wood Johnson Foundation?
Well, sure. So practically, we want to see a 20% reduction in our 3 measures. But really, you know, what we want to see in the whole task force, what we all really want to see in Washington State is kind of the beginning of a cultural change. You know, we really want to see a shift in thinking from thinking more care is better care to just simply better appropriate care is better care. And so we really want to see kind of the state kind of move in that direction. So the task force and our organizations definitely have big, audacious goals, and we want to see it in that direction. I know in 3 years we won't see a full cultural change, but we definitely want to be heading in that direction.
And what's some steps that you've done to do cultural change?
Well, so I think it's getting all of the stakeholders engaged and activated. So not just the providers at the provider level, but you know, we're about to go and really get the different purchasers and government and education and different consumer levels, and you know, really get them engaged at a kind of a grassroots level, so that everyone kind of takes this on. And so I think that framing kind of that cultural change has to come from that grassroots level, so it becomes that cultural change.
A lot of conversations are going on amongst groups, between different stakeholders. It really is impressive. Thank you, Teresa, for your time, and good luck with your project. This has been Daniel Wolfson at the ABIM Foundation and Choosing Wisely. To learn more about the Choosing Wisely campaign, please go to www.choosingwisely and hit on resources and look for updates from the field to see news about Choosing Wisely and implementation of the Choosing Wisely recommendations.